let's really quickly talk about kidney transplants. So, I mean, this is the, for someone who has a chronic kidney disease or even an acute kidney failure, this is the best option for that person, because we don't want to be on hemodialysis or even peritoneal dialysis for the rest of our lives, right? So what they can do is they can take a donor kidney from either a live donor or someone who has passed away, and they can transplant that into the patient. So the way that works is there's a transplant list. You put your name on the transplant list, and it's based on availability. It's based on compatibility. You have to have, there's a bunch of different things that need to match, one of which is your blood type, right? But the success rate is really, really good for kidney transplants, particularly. So if you get a transplant from a deceased donor, it's a 90% chance that you will have a functioning kidney after a year. If you get a kidney from a live donor, it's a 95% chance that you will have a functioning kidney after 1 year. So the chances of rejection, which we'll talk about in a minute, is actually quite low with a kidney transplant. I believe kidney transplants were the first, or one of the first, transplant organs. And I know you guys know that we have 2 kidneys. That's why we can use a live donor, because you can remove one kidney and the other one will actually work just as well. It's just nice that we have a backup. A little bit different than live liver donation, we'll talk about in another week. So there are some contraindications for this. Any kind of like really serious medical condition that's not going to improve after you get the transplant. So metastatic cancer, for example. So metastatic means basically means it's spread. So it started somewhere else, but it's spread. So usually when you get metastatic, it's at least, well, it's at stage 3 at that point. So you are at too high of a risk to have a kidney transplant. Any serious cardiac or peripheral, like vascular disease, liver problems with your liver. One of the interesting things is medical non-compliance. So if you are a person who has a history of not taking the medications that have been prescribed to you, or if you can't take them, or if you are not able to follow through on doctor's orders, not just for meds, but for rehab and all of that kind of thing, that's a contraindication for surgery. And that's because it's actually very, very hard to get a transplant. I don't want to say hard, but the lists are very, very long. It can take a very long time to get the transplant that is needed. And the idea is that those vital organs need to go to somebody who is going to have the best chance of living. There are other criteria. There's a ton of criteria. We don't need to worry about that, but that's kind of the gist of it. So one of the issues is that when you transplant an organ from one person to another, the body will sometimes reject that organ based on, an immune system based. The way I think of it is that the immune system recognizes something foreign and attacks it. So in order to prevent that from happening, transplant patients are put on a cocktail of immunosuppressant drugs in order to prevent that rejection of the new kidney. Sorry, here we go, rejection. So this is actually really not a huge problem in kidney transplants at this point. Very, very few patients will reject a kidney after the first year. Unfortunately, when you do reject it, often there are no symptoms until suddenly you'll have this rise in creatinine, right? Which we know at this point indicates your kidney's not working well. right? So people who have kidney transplants are usually monitored very carefully. They have their blood work done. They have immunosuppressants. They're followed very, very carefully. Yeah, so I know it's a really short video, but at least you have an idea of what a transplant is and how it works. Let me know if you have any questions.